then comes the communication piece, where the primary care provider, in preparing for this visit, communicating with your care manager, did she or he help you do some pre-visit screens? Are they already back? Because they can be submitted electronically. So to review those, and if there's something worrisome, having your care manager alert you to that. The care manager is going to have a pretty good idea, if she's that touch point person within your office, that this is going to be a pretty time consuming visit. So make sure you're dedicating the appropriate amount of time to this upcoming visit. If there's been if it's both not just pre-visit planning for the initial visit, but subsequent visits down the line, looking back at some of those surveys that you've done, are their PHQ scores improving? Are their GAD-7 scores improving? So looking at those sequentially, and to have a good idea of what you're walking into when you go into that room or go into that televisit with that patient. Seeking those records from the consultants, that's a really time-consuming process, making those phone calls, sending over the fax, or requesting records and some type of communication of how this patient's doing. If they're seeing a therapist or psychologist or a counselor in the community, can you get some feedback from them of how this child's doing? Because they might be seeing that person with much more frequency than they're seeing you. So to be able to pull in that information. But as we know, sometimes it's like pulling teeth. So the care manager is very helpful in pulling that in. And then again, making sure that you have consent. So taking all these pieces together as you prepare for the upcoming visit.